Hi, I'm Dr. Hale. Today we're going to talk about diagnosis of plantar plate injuries. We typically suspect a plantar plate injury when your toe elevates, especially your second toe. The word plantar just means bottom of foot. The plantar plate is a strong fibrocartilaginous tissue on the bottom of your forefoot. It connects your toe with the lesser metatarsal head. It allows the ball of your foot to support significant forces and keeps your toe on the ground. Basically, it's a strong ligament type structure on the bottom of your joint, keeping your toe down and fluid in your joint. If your plantar plate tears, your toe will move upwards, sometimes sideways, and joint fluid will leak out the bottom of your joint. Also, the metatarsal head may protrude through the bottom of the joint. All these things may cause pain. The symptoms of a plantar plate tear are typically elevation of the toe, pain and swelling on the ball of your foot. Symptoms are aggravated with running and walking, especially barefoot. The plantar plate tear may be due to an acute or chronic injury. Acute injuries are caused by sudden forces tearing the ligament. You will notice immediate swelling and elevation of your toe. Chronic repetitive forces to the joint may gradually cause the ligament to tear, also resulting in elevation and pain. Acute and chronic injuries have different treatment plans. If you have an acute injury, it is important to see your foot and ankle specialist as soon as possible. The condition is diagnosed on clinical examination due to instability of the joint. We perform the Lockman's test to evaluate for excessive upward motion at the base of your toe. Injecting dye into the joint is utilized to confirm the condition and evaluate the extent of the deformity. Injecting dye into the joint is called an arthrogram. You can perform an arthrogram on X-ray or MRI. The flexor tendon sheath is under the plantar plate, so we typically see dye going into the tendon sheath. Ultrasound can be utilized to evaluate the plantar plate, but injecting your joint with dye is the gold standard. Overall, to diagnose a plantar plate injury, we look for elevation of your toe off the ground, pain on the bottom of your foot, laxity of the joint, and an arthrogram showing joint fluid leaking out the bottom of your joint. If you have any further questions about this condition or any other foot and ankle condition, go to our website at footankle.com. If you're interested in shoes that may help your foot for this condition or any other foot and ankle condition, go to our website and input your email address at the bottom. Thanks for watching.